welcome to everyone joining us today for this conversation about the future of health and social care and how AI can help us provide better care. My name is Maxine. I'm a venture associate at Rainmaking, and I'll be your host for today's session. I'm joined by a brilliant panel of experts who each provide a different, unique insight into the current landscape of health and social care in the UK, as well as the potential of AI in this sector and the steps needed to address the barriers to adoption. So it's my pleasure to welcome our panelists, and could you please introduce yourselves?
It would be a pleasure. Thanks, Maxine. Hi, everyone. So I'm Dan Avery, part of the leadership team at Rainmaking. And for those of you who don't know, Rainmaking, we work at the intersection of government, big business, and startups. We focus on delivering and scaling innovation for economic benefit or development. Over to you, Matt.
Thanks. Delighted to be here this morning. Thank you, Maxine. My name's Matt Skinner. I'm the chief exec of an organisation called Care City. We're a social enterprise that's based in Barking Dagenham. We work across North East London, supporting health and social care partners in local government with innovation. And a lot of our work involves really closely understanding the lived experience of our communities and frontline practitioners to help support the design of new and improved ways of working.
Great, thank you, Maxine. My name is Tim Pearce. I'm Head of Insight and Innovation at the London Borough of Barking Dagenham. So that is a corporate team that supports the organisation with a range of things, but it includes prevention using advanced data methods and service design.
Awesome. Well, welcome to the three of you. It's great to have you here today. So for context, recently, Thames Freeport, Rainmaking, and Care City has actually been working closely with the London Borough of Barking Dagenham, Havering, and Thurrock to launch the Adult Social Care Accelerator, a program that worked for its first cohort with 6 pioneering startups based in South Korea, who each offer different innovative AI-driven medtech solutions that tackle different challenges that affect the aging population. And we'll talk about that in more detail today. So our goal is really to explore how AI may shape the future of health and care, and also highlight some of the great innovations that's currently taking place in the UK. We'll have some time at the end of this for questions from the audience, so please pop them down in the Q&A box, and we'll get to those at the end. So let's get started by getting a bit of a better understanding of the social care landscape. So Matt, from your experience working at Care City, could you give us a bit of a high-level insight into some of those challenges?
Yeah, it's a big question. And I'm sure a lot of our audience will be familiar with a number of the challenges that are facing adult social care at the moment. But just to kind of give a bit of a flavour, I guess, of some of the high-level challenges, we're all aware the population is ageing. I think something like by 2040, 1 in 4 of us will be over the age of 65. Increasing demand on social care as a result of that, and the advance of like people with comorbidities and rising health inequality is going to be hitting social care quite heavily. We know locally in Barking Dagenham, actually through some of the work that we've been doing recently, that about 12% of the population would say that they feel socially isolated or lonely some or all of the time. So pretty stark in terms of some of that in the population that we are part of, Care City. And with that rising demand, we've also got the supply issue, I guess. So there's huge workforce challenges in social care. At the moment, I think Skills for Care talk about 150,000 vacancies in the workforce, which obviously then also has a big impact on the way that health and social care are supposed to be integrating. And then on top of that, I guess we all know about some of the changes that are happening in the NHS at the moment, 10 years of austerity and more, the challenges there are mounting. And I think also just wanted to mention a little bit about some of the provider network who we've been working with on things like the Adult Social Care Accelerator. I think around 45% of care providers in the UK at the moment have access to the digital care record, and a lot of the infrastructure in things like care homes, domiciliary care is still not as good as it could be. We're actually doing some work on another care technology project at the moment and rolling out care technologies to support more proactive and preventative ways of working. And I know that one of the technologies that's being rolled out the most in terms of hardware is a router. So it just kind of shows you kind of the state, I guess, of some of that infrastructure. But there is a lot of opportunity, and hopefully we'll get into that in some of the chat today.
Great.
Yeah, for sure. And I think one of the things that I've certainly learned through working closely with the boroughs and Thurrock and Matt, that's really surprised me is just how challenging health spans are in the UK at the minute. So you might expect to live, late 70s, maybe beyond if you're lucky.
Yeah.
But actually, the proportion of that's healthy is, on average in the UK, for men, I think it's 4/5, and for women, I think it's 3/4. Health spans, I think, around 65, 68. So it's actually a really challenging period in later life where, at the minute, too many people are, struggling with chronic diseases such as dementia, diabetes, musculoskeletal challenges, and other related, quite a bit, many challenges around cardiovascular health. And so, for me, it's really underscored the importance of getting predictive and preventative where we can. And we'll get on to that a bit more, but needless to say as well, the region that we operate in, or we're focused on here, is below national average as well. So if that sounds scary, it's even more challenging. It can be even more challenging for local population.
No, definitely, and thank you both for that great insight. And I think that's a great segue. Dan, could you tell us a bit more about what Thames Freeport is aiming to achieve at the moment? Because they're driving more innovation to the region and more investment, but could you tell us a bit more about their broader mission?
Yes, I can. I'll do my best. I'll put my Tom hat on. So, Tom White, who is head of innovation at Thames Freeport, sadly couldn't join us today, but I will do my best to represent Thames Freeport and the mission, an exciting vision that they have. So, Thames Freeport is focused around the boroughs of Barking and Dagenham, Havering, and the Council of Thurrock, and it's a public-private partnership between those local authorities, the DP World, who owns and operates London Gateway Port, Forth Ports, who owns and operates Tilbury, and Ford, which owns a manufacturing plant in Barking and Dagenham. And the Freeport's mission is really ultimately to regenerate this region over a long-term period and drive sustainable economic growth, attract skilled, high-quality jobs, reduce inequality, and that's really important in this region. It's post-industrial, it's unloved, it's very much behind UK and regional averages across the board, really. Things like unemployment, health spans, as we were talking about then, lifespans, GDP per capita. There's a lot that we can do to help support the local people. And what's really nice is Thames Freeport and its founders have a relentless focus on local impact and improving the lives and prosperity of the people in the region. And so that's really what this program is a part of. And this program is focused on, doing a bit of that within the area of health and care. So aiming to reduce health inequalities, improve the health outcomes, and crucially get ahead a bit of some of the challenges that we see later in life. So, through AI and other technologies, get a bit more predictive, preventative, and reduce the burden and strain on family carers, on local authorities caring, on the NHS and health service. And whilst we're doing that, wouldn't it be great as well if we could attract, top global technology businesses to the region, which bring high quality skilled jobs and upskill opportunities for the local people? Wouldn't it be great if we could stimulate and encourage a bit more of an ecosystem of health and care tech in the region, so we can attract more talent and more businesses like that, and hopefully raise the profile a bit, so we can attract over time, perhaps even bigger inward investment from bigger business, etc. So that's really ultimately what Thames Freeport is aiming to do with this, and I think it's a really interesting pioneering program to do that.
That's great, thank you. That gives us a better understanding of what they're trying to do. Can we get a bit more specific about the accelerator now? Because I know we've mentioned it a few times, but yeah, could you tell us about the accelerator? What were some of the goals when we set it up and what it was trying to achieve?
Yeah,
Love you.
but fundamentally, yeah, I can just go really brief, but fundamentally it's about identifying real challenges on the ground across Bucking, Dagenham, Havering, Thurrock, that we can solve with leading, things that might have been challenging, several years ago, but now with leading AI and technology solutions, we can actually start to do something about those in a more cost-effective, scalable way. So it's about identifying those challenges, bringing in local and global innovators to help solve those problems, and through doing that, attracting those companies to come to the region, invest in the region, set up headquarters or satellite sites, maybe manufacture, perhaps medical devices in time in the area, and sort of create that economic benefit as well as the health and care benefit. So fundamentally, that's what we're up to, and that's why we've been bringing some solutions along to the residents and to the care sector here. But yeah, I'll let these two add a little bit as well.
Well, I mean, I guess just to say, in practical terms, what we've been doing then is over the last few months really kind of understanding the lived experience of residents in Barking, Dagenham, Thurrock and Havering, talking to the local authorities, practitioners, people on the front line to understand really clearly what some of those needs are, and then working together to kind of source potential opportunities for innovators to come in and demonstrate how they might resolve or help be part of the solution to resolving some of those really complex challenges that we probably talked about in the opening. So yeah, from our perspective, like taking a kind of test and learn approach, like putting some of these and Dan's wearing one on his wrist at the moment of those technologies, but like putting them in the hands of real users and kind of really understanding what that experience feels like for people who could benefit from these types of technologies, as well as then working with partners in the voluntary community sector, health, local government, to understand how you'd practically implement them and how the data and things could be used from them to really inform that practice. It's been really quite exciting.
Yeah, and I think just from my perspective, just bringing some of that together is there is a huge amount of opportunity. As we say, it's a bit of the country that, despite being so close to London, does worse than average nationally. So there's a huge opportunity. And what's exciting about this is that you're bringing business and tech to bear on to help the outcomes for people in this region, and focus on areas like social care, which are desperate and crying out for kind of innovation and new ways of working, which achieves both the goals of the Freeport, but also outcomes for the people living locally. So it's really exciting.
Yeah, no, you're right. And I think we've seen through this accelerator and by speaking to other tech businesses that many of them are eager to expand in the UK, but they do face certain challenges in trying to expand to the market, whether it's navigating a complex and kind of fragmented healthcare system, or working with customers who have a different approach to managing their health and who have a different level of awareness. So in order for them to succeed, that transition needs to be low risk and be commercially viable. So with that in mind, what do you think some of the benefits are for tech businesses looking to expand, the benefits of the accelerator? How can we kind of support them with those challenges?
Yeah, it's a really interesting question. So it's something we, like as a business, we've been looking at for some years, and we created a series of programs under the brand like Expand to do exactly that. And it's because I think traditionally a lot of effort and many of the programs around supporting export of startups and solutions has been a bit focused on helping with translating between kind of cultural differences and helping to maybe prepare startups across some of the more typical accelerator aspects, around like business model and knowledge of customer and sort of target sectors and but I think what's ultimately really, really valuable for anyone moving to a new country is just customer relationships, and actually if you're going to expand, you need to be able to, especially as a startup, you need to be able to do it commercially. You don't have a finite, you don't have an unlimited pot of cash. It's very finite. So what's really important that we're doing to help these companies sort of succeed and to attract them in the first place is, understanding where that sweet spot between commercial opportunity for them is and, solving real problems and delivering commercial benefit for kind of, families, local authorities, etc. on the ground. Validating those sweet spots and then trying to scale that up as quickly as possible. So making connections between the businesses and local users and customers, and not just one or two, but understanding when they're successful with pilot or initial customers, there's a whole raft that can also benefit from this, and we've got a sort of a scale and a growth path ultimately for these startups. So I'd say that's probably one of the most important aspects in terms of providing benefit back to these startups and these international innovators.
Nice. And sorry. Go on.
Well, no, I was going to say, I think I'm going to blatantly steal somebody else's quote here, but I think there's something like 80% of like new startups, particularly in technology, sort of fail because they haven't been introduced to the system or to actually test with real users.
Yeah.
And I think one of the real benefits of the approach with the accelerator, and look, we're not the first accelerator that's ever existed, right? But in social care, as Tim said, there's so much opportunity and so little in this space. I think we're playing a really important role, and we need to bring more people to this, I think, in the future. But actually, I think being able to kind of test and prototype with those organizations is really giving them insight into how things work for some of the companies we've been working in the UK market. But I think I've been talking to lots of innovators in technology who are trying to kind of bring their products to health and social care, who don't have that opportunity, and frankly are taking their work at, these UK businesses who are taking their technology to other places, like other countries.
Yeah.
So I think we've got an opportunity through kind of testing, experimenting, giving access to the market for some of these providers, be they international or in the UK, to help them identify what the opportunities are for scale and to support them in doing that. I think with partners like the local authorities is really, really important.
But that's the nice thing about the role that Freeport is playing. It's connecting, tech companies, investors, government, and seeing what works for everyone. Because certainly from a council's perspective, a focus on adult social care. It's absolutely front and centre of almost all councils' agendas. And with the Freeport paying that, this is what they need, this is what they need, this is what they need. You start to get a really interesting flow of kind of ideas and technology and stuff. So it's really exciting.
This is a great point. I mean, ultimately we're looking at systemic challenges in this arena, and so the role that the Freeport plays in spanning public, private, smaller scale innovative startups and kind of larger scale business is really important.
Great, thank you. Yeah, you kind of have answered my next question about what are the real benefits and impact the accelerator can offer to councils and care providers. But you've kind of touched on that. But anything else you kind of want to cover in terms of
I think the
benefits?
thing I'd just say about that is just we know, especially as councils, but the public sector in general, we need to be more preventative. We need to do that to provide better services to people, but also to be financially sustainable. And so this kind of technology, data, that's exactly the sort of opportunity for understanding who's at risk of a poor outcome, and can we do something about it today to stop it happening in the future. So I think, again, really exciting to be focusing in that sort of space.
Thanks, Tim. And actually, I'm glad you brought that up, because I was going to ask you, I know you've been doing some incredible work in Barking and Dagenham, applying AI to complex challenges like fall prevention. Could you tell us a bit more about the work you've been doing, please?
Yeah, absolutely. So it is in that space. So we all know we need to be more preventative, but how do you do that alongside doing business as usual when there's so much need for your acute services? We've been through our what we call our localities program, trying to get ahead of some of this demand, doing preventative work using data. We started quite simply with looking at people getting into debt and seeing if they could do with some debt advice, right? So the council knows when people get into debt because they get into debt to us in their council tax or in their social housing rent. And we also have a debt service. So why not connect those two things so that when someone gets into trouble, you offer them some debt advice? And this was, it helped a lot of people. A lot of people were eligible for stuff they didn't know about. It got people back on their feet, but also ended up paying the council back the money they owed. So it's totally win-win. Didn't need huge amounts of investment. And I think that's the opportunity, especially in councils where we have a range of services, a load of data, and a set of residents. And if you think differently about those beyond the traditional service silos, there's really big opportunity. And so we're moving from kind of simple like data stuff and matching people to services to getting into kind of machine learning approaches to understanding need. So we've kicked off something around homelessness, so using our historic data about who became homeless in the past to understand, well, what was going on in those people's lives, 9 months before that, and is there something that you can see in council data where people are, at risk of this kind of stuff? And this is not magic. It's like they go into debt, that kind of stuff. And so you can apply kind of a machine learning approach to that data to work out who's at risk now. So we've just started that, but yeah, in terms of, I guess for this conversation, we're working now with the NHS to do the same for falls. Falls is a huge driver of need to the council's care service, but also to the NHS, and it's also something really preventable. So we are working with the NHS to both share data, to create a model which understands the risk of people having a fall, and then for anyone that's at risk, we're going to offer them a service. We're going to have a chat to them to see what sort of what's going on for them, and that could be a range of things. It could be a handyman service with grab rails. It could be all sorts. One of the things we're working on as part of the accelerator is things like digital medical adherence. So medical adherence is a risk around falls. So it's, we're using AI. What's really nice about that is it's pushing us to work with our partners, so the NHS, and again, they recognise the approach is a valuable one, and so are dedicating their scarce resources to joining this up. And we'll be kicking that off later in the year, and crucially, we'll be measuring it and checking the impact, because we need to continue to make the case. We need to work out if we want to scale it. We need to work out what went well, what went less well. We need to build this into business as usual, working with the NHS.
Tim, I think one of the things that I've been thinking about, particularly in the work that you're doing and in this conversation, I guess, is like, whilst we talk about technology and AI, a lot of what you're describing is AI supporting people to do care, right? And that could be unpaid carers, it could be the broader care workforce, it could be social care workers. But I guess I think there's something really important in what we've been learning through the sort of the Adult Social Care Accelerator, is that I think the best of these tools are the ones that are supporting caregivers to use data, to use analytics, to better inform how they deliver that practice for the end user, for the person. And increasingly, actually, like the watch that Dan's wearing, for people to be doing that themselves as well, and kind of how people use their own data and to make decisions about how that care is directed. Any thoughts about that aspect?
Yeah, I so agree with that. It's so funny because I'm a data person, and social workers are naturally worried about data people in their area, and rightly so, right?
Because you are scary, Tim.
I'll take that as a compliment. So because what they expect is something's going to happen with a computer that's going to tell them what to do, or tell a resident what to do, and that's not how social care should work. No one thinks that. So I am very passionate about the role of data, AI, tech, and all that stuff, but it absolutely must be delivered by humans in a human-centered way, in a way that is gonna help people to live their lives. And I think that's sort of why, in this outreach that we're doing, so we've got an algorithm, got that data bit, but that's not going to be then, right, have this, the computer says you need this, buy. That is a conversation, like what's going on for you. And if that person is, socially isolated, or if there's a carer struggling to provide care for then what does support look like? Is it, do we have other existing things? Is the voluntary sector? I mean, in an ideal world, you could build up a relationship, with that person, and they might just need a cup of tea and a chat. Who knows? But the human element of this has to be there alongside the digital tech for this to be, effective and something that people actually want. That feels like, oh, wow, because that's sometimes what happens when we speak to people. They're like, this is the council. Wow, great, and they're almost surprised that we're working in this way.
Yeah.
So, just a quick question on that. Maybe building on the idea of data people or data being a bit scary. Like, do you expect there'll be any challenges or kind of negative fallout from the idea of the council, trying to be a bit predictive or thinking ahead on behalf of people in that way? Obviously it's coming from a good place, but it might at first appear a bit scary. Is that something you've addressed, or
it absolutely is? And there's a whole legal part of that question. There's a whole ethical part of that question. But specifically, if we're talking about how do residents feel about this, they are, the idea of, government going through your data to work stuff out is scary. But when we've done focus indeed with Care City, where we've talked about this, and what the essential thing is here to explain what exactly is going on. What are we talking about here? What will we do? What won't we do? And for the work that we've been doing, which is saying taking data, processing it, working out who's at risk, and offering extra services. We're not taking anything away. It's not that everyone can see your data. And it's only done to help you, to help residents. People get that. And, actually a lot of the time, it's almost like at that point, they're like, oh, is that not what you normally do? Are you not normally using, what are you doing otherwise? Yeah, I know, it's scary, isn't it? So there's a real understanding piece to this. And so we're trying to put stuff on our website about it, but even terms like data processing, right? So we've had a long conversation about, we process resident data. Now, a lot of people are like, I don't want you processing my data. But that just means some ones and zeros are going through some database somewhere. No one's seeing this stuff until we get a list of people at risk and we want to give them a service. So because we're processing data of people who won't get a service, but that just means it's going through a computer somewhere. We're processing that in other ways as well, but no one seems to care about that. So I think talking about it and getting people to understand it, I think will help us get the buy-in and people to be like, yeah, no, this is great, this is something we want, we like this, rather than, oh no, scary government, my data, what are they doing with it, that kind of thing.
I mean, I think adding to some of this and in terms of some of the technology through the accelerator that we've been kind of testing as well, I think there is an increasing amount of this kind of predictive, preventative technology now, which is kind of acoustic. It kind of like lives in the background, like it's not recording visual images. Like I think there's something really important about the decisions that we take, I guess, in terms of the types of technology that's being used to collect this data, not only co-designing that with the people who will be benefiting from it and caregivers, but also thinking really carefully about people's privacy and building that confidence, and working with people to kind of raise that confidence as well by showing them and demonstrating. But for me, and I know the government is talking a lot about this at the moment around care technologies, like helping different local authorities, helping the health system to navigate some of the advantages of using maybe some of those more those kind of technologies that kind of live in the background rather than are a bit intrusive in people's lives feels an important part of this as well.
Exactly.
Yeah.
I might just use the opportunity to bring in what we've alluded to many a moment on this podcast already, but I think this device is an interesting example of something that sits right on the fence of sort of being acceptable but being challenging. So to explain, this is a smartwatch by a company, pioneering Korean technology company called InHand Plus, and it's a really, really interesting solution which does many of the things we're all familiar with respect to smartwatches, but it's also got a camera in the strap which can look at whatever's in your hand. And it's got an onboard AI chip which can analyse and process within the watch itself. the whole idea of having this here is so that you can do things like, check you're taking medication, the right medication at the right intervals during the day. You're not mixing it with foods you're not supposed to, and it can go far beyond this. It can look at more sort of broader dietary, nutritional, behaviours and adherence, etc. But I mean, this fundamentally is quite challenging. Could be quite challenging for someone to accept. Having a camera that's always on. So by having the AI chip embedded in the device and being able to process a lot of the data on the device itself helps. It's not enough for some people, but it helps. And I think to truly scale something like this, a few more aspects will need to become, to your point, Tim, like very clear for people. Like what is it doing? What can't it do? Like where are those boundaries? And is that okay by people? It's got some other, it's got a little window you can shut off if you don't want it to see something, which is a great, it's a great intervention. But I think, some of these aspects are the kind of things that will need to be solved and we'll need to get a lot better at to get, good AI solutions scaling and, widely adopted across private, public, all parts of society. So it's a really interesting debate.
Thanks. No, you guys, thank you. You all shared some really good insight. I think a couple of things that really stood out to me is that, I know we talk about it a lot, AI is not really here to replace people. It's here to support them and enhance the kind of care we can provide. And often it forms part of a more holistic approach to tackling some of these challenges and the importance of really taking these people on the journey as we start to introduce some of these new solutions. So one more question on that, Tim. For people in the councils or who work in councils or in the NHS who are sitting on these large volumes of data, what is your advice for turning some of this information into actionable insights?
Yeah, it's a good question, and one that's asked a lot. So there's lots to this, but I'll just focus on kind of headline stuff. So number one is, I'd say, focus on a big challenge. Focus on something that people are going to be like, actually, this is worth spending some time on, because often this is going to come on top of people's day job. So it needs to be something that's like, well, it's worth doing. So that's number one. Number two is, I think the prevention area is just so ripe for this. So I'd really recommend that sort of stuff. As soon as you start like playing around with how services are done right now, you've got to do stuff in flight, and there's all sort of legal and regulatory ramifications. But like, let's start thinking about prevention, because it's quite an open field right now, and there's loads of opportunity. So that's the second part. The third bit is like, do you actually have any data on it? Because there's loads of stuff where it's like, we'd love to do some prevention, we don't know anything about it, so that's really hard. So what kind of data do you hold? Does it feel like that could tell you something about risk or where people are? It doesn't have to be ultra sophisticated. It just needs to tell you something about the nature of the problem that you're faced with. And then finally, is there something available or that might be available that can reduce the risk for people? That could be that in a lot of cases, stuff, you don't have to invent brand new stuff. I mean, in some cases in the council, we already have stuff that could help people, but we're just not deploying it in that way. So there's some quick fixes, and then there's also some really innovative things like the stuff we're doing as part of this program, where we go out and reach out to startups and say, well, we got this issue, like what sort of stuff have you got? So I think combining those four, if you can get something that ticks those four areas, you're already in a really strong position to get people around the table and start a conversation.
Great. Thanks for sharing that. It would be great to dive a bit deeper into some of the opportunities AI presents for both care patients and caregivers. So question to all of you, but maybe we start with you, Matt. You've given us a good sense of some of the challenges. What role do you see AI playing for both care patients and caregivers, especially at different stages in their journey and at different levels of support?
Yeah, I mean, I think we've touched on this a lot, probably in different ways, but I think like certainly that kind of early intervention and that preventative role that these kind of technologies can play is a really important one. So like I was saying, I think the use of AI to generate insight about the person who is kind of managing their own care, like like with the watch, for example, like in terms of being able to make better informed decisions about how they live their life is a really important part of this. But also, of course, if we think about domiciliary care workers, the opportunity for giving them access to technologies when they're going out and caring for people who really need that extra support, and the benefit of having that kind of insight and intelligence to help them adjust the plans and the support that they're giving in terms of that care to somebody feels really important. I think, like an example of that actually from the work that we've been doing through the accelerator, there's a really amazing organisation called Smartooth who have developed a kind of piece of technology that can really quickly help you identify whether somebody might have some gum disease going on, and we've been testing that out in care homes. Because obviously access to dentists across the country, challenging, but particularly so for people in care homes. And so you can imagine that kind of technology being really quickly used in those settings of care, identifying somebody who's got an issue, getting a dentist in before that becomes a real serious problem, and not only the outcomes for that person, but the cost of that, getting worse and worse and worse. So I think, some really great applications of this kind of technology in that space in terms of prevention. I think also I said earlier about that kind of intrusive thing. Mm-hmm. So we've been working with an organisation through the accelerator called JCF Solutions, who have created this device that is really passive. It uses radar to kind of monitor people's movement, and it can detect multiple people moving around an environment, like a kind of care home, living room, but it also can do things like listen to people's heartbeats, and it understands whether people have got potential issues by determining the difference between those people in a room, which again is like this really useful, not intrusive kind of technology that's allowing people who are delivering frontline care to make really informed adjustments to how that care is given. And if I think about the application of some of these types of tools, and there's many more in the UK I know, like we've seen, that are being used to support people who are having waking night service, for example, who might be needing 3 or 4 carers to be in a live-in facility kind of on call to help make sure people are okay throughout the night. Using some of these technologies alongside that could potentially mean that we don't need quite as many people obtrusively going in, waking people up, because we're passively monitoring that in real time. So I think some really, really amazing opportunities there, not least because the workforce, as I said earlier, 150,000 vacancies, and that's probably not as many as is actual reality. Like, it's overstretched. So I think the advantage of these kind of technologies for people giving care is also that we could potentially help to offset some of that challenge for the workforce.
Thanks, Matt. Anything else from you, Dan or Tim, on this?
There's probably a couple of other solutions which I'd give as examples, because they pair up really nicely, and they show the opportunity to do predictive and preventative well. So there are 2 focused on predicting and preventing mild cognitive impairment, which can go on to, which if left untreated, unresolved, ends up in dementia. There's one which is a company. It's called the solution's called 7.1, and it's a predictive technology that really quickly, within 1 minute, can identify if someone has mild cognitive impairment on set. And it does so through analysing voice, which is quite different and really interesting, because it means all of a sudden you don't have to have a lengthy in-person assessment. Yeah. It's really scalable. So this company in Korea has been scaling this by, through councils performing outreach to hundreds of people in the local area, doing very quick voice checks over the phone, and identifying hundreds and I think in some cases thousands of people who would otherwise not be caught by the system, if that's the right term, until much later, when it's more of a challenge and less can be done to help delay the onset. So I think that's a really interesting example of kind of just slightly getting ahead of the issue at an important time in a really kind of low cost and scalable way. That could be really accessible for a lot of people. Yeah. And then pairing that up with another solution that we've been working with, which is by a company called Sylvia, and this is essentially a sort of a brain training type solution, but focused very much on working with people who have mild cognitive impairment, and providing them with routines, exercises, nutrition advice, other kind of wider holistic advice to help delay the onset of mild cognitive impairment, and stop it from getting more developed, more progressed. And you can imagine the power of those two things together. It's not suggesting those solutions will be right for everyone, but even if it's right for a decent chunk of the population, like a third or something, it can still have a really big impact over time, and help people understand better, the state of their health, and to Matt's point, be caregiver or the person themselves, help them, and counsellors as well, help them all understand, where we're actually at. And what kind of services and support and behavioural interventions that people can make to help improve the situation.
I think that's really interesting because we've already listed some really interesting stuff that the public sector should just be testing right now.
Definitely.
And how do we get councils, the NHS, whoever, to be doing this? How do we foster that? How do we, there's particular risks around trying new things with vulnerable groups, of course, but we need to be doing that thinking, we need to be piloting, we need to be having the conversation about how you test innovation in these sorts of spaces. And so again, it's a great thing about this this accelerator program, it's a great thing about Freeport, but we should be thinking about this much more like across the whole sector, like how are we bringing new ideas in, testing them quickly, working out what works, what doesn't work, and changing services so that they are fit for the 21st century, basically.
And an important part of that, Tim, is obviously capturing the evidence and the learning, which is baked into what we're doing. I think needs to be baked into any of these types of approaches. I know you're regularly blogging with your team about some of, but I think that stuff is massively important. So there's a qualitative kind of storytelling piece to this, which is about helping others to really understand the benefits. And I mean that in terms of both the workforce, but also people who could benefit from these technologies themselves. But then there's also the quantitative, right? Like, you talked about risk, but it's also cost. Like, how can we be confident that these devices do the thing that they say they're going to do, but also will help us to save money? And I think that's a really important part of what we're trying to do with the accelerator as well, is to kind of help, albeit in our Freeport zone at the moment, like the boroughs that we're working with, to understand the benefits and the impact. But that should then serve as evidence for other local authorities, other bits of government, like, to do this as well. And frankly, for people who want to just buy this kind of technology themselves, I think, in the future.
Critical.
Oh, that's great. And we're seeing how AI is being adopted at scale across various industries, each with their own growing use cases. So a question to all of you, what do you think is the risk for the health and social care sector if they don't invest and adopt AI now or soon? Big question.
I mean, I think the sector as a whole is in crisis. I think that will be broadly acknowledged. There's huge workforce challenges. There's big financial challenges, and that's on top of some of the stuff that Matt mentioned earlier about an aging population. So I think I'd be right in saying most people say what we have today is unsustainable, and so the question is, what are we going to do about it? And there's a range of ways. Like, it's not that AI is our only hope, but it is one tool. AI data tech is an avenue that it's there. It's even in this conversation we've talked about interesting things that could be tested. So let's get on and see to what extent that can help us with the challenges we're facing in the sector, alongside a load of other stuff that will be needed as well. I don't know if you guys would echo that.
Yeah, I would definitely echo it. I mean, the thing I was thinking from a slightly different angle in relation to this question, though, as well, I think we often talk about the NHS and sometimes forget that social care exists, but social care is, in terms of workforce, about 1.5 million people. I mean, that's a pretty significant part of our economy in terms of that economic growth agenda for the Freeport. I think there's if we're not introducing these kind of technologies, if we're not introducing new skills around AI, then I think we're doing a disservice to quite a huge part of our economy, actually, in terms of those skills and the sorts of tools that we want people to be using as part of their work. But also, those people in the workforce will probably be caring for people themselves, or will need some sort of technology or whatever in the future as well. And I think by not doing this kind of stuff, we're probably suppressing economic growth.
Totally agree. Maybe just building on that, I'd say that the risk is probably greater of not doing anything with AI. And if you think about the amount of unpaid care that goes on in the UK by families, if we can, just taking that alone, if we can make that just a bit easier, and reduce the sort of burden and strain on family members and unpaid caregivers, that would have a huge, economic benefit and impact on the region and the UK more broadly. I also think as well with AI, it's often, yes, there can be some negative consequences for certain types of jobs, certain sectors, there may be risk of displacement. But I think in, the way we're thinking about it and the opportunities in health and care, look to me anyway like the opportunity to create higher quality, more attractive jobs for people and almost make the sector a bit more attractive for incoming talent. If we can save some money in less crucial areas, if you want to put it that way, or kind of areas that are ripe for AI, it can give us more to invest back into care, into training caregivers. Perhaps there are interesting roles for carers. I know it's something Matt and Care City have been exploring, for carers to both be, providing aspects of care and also, leveraging technology themselves and AI themselves to, to be more predictive and preventative and to be more supportive of people. So I think there are some really interesting opportunities to deliver benefits across a range of aspects with AI.
Thanks, Dan. That's really nice. And you've kind of touched on my next question, but yeah, how do we ensure that AI doesn't just automate care, but actually improves it in a meaningful, human-centered way?
One thing I was just thinking as Dan was speaking is, one thing I mentioned right early on is we have a big workforce challenge, right? Whenever you see the stats, there's like hundreds of thousands of open vacancies. So even if you do slightly reduce the demand for people to work in this space, that's not going to be a problem because there's not enough people. We cannot get enough people doing these jobs. So I think there's, as exactly as Dan says, like making the jobs, having slightly fewer jobs, which may be better quality, better paid, who knows, shouldn't have a particularly negative impact on the total. It will actually have a positive impact on the workforce, on growth, on the delivery of care. So I think that will be my starting point, but I don't know if that's controversial.
You think there's enough sickness to go around, Tim? Is that what you're saying? But I think that's true. I mean, I think we found, so in a bit of a different space, but like trying to introduce technology into domiciliary care to do kind of proactive health monitoring. I think there is a bit of a concern maybe that there's a bit of a threat to the workforce, and but actually I think we're viewing those kind of technologies completely wrong if that's how we're allowing it to be understood, because I think actually where we've introduced these technologies and as part of the pilot, what you've seen is people who are delivering care suddenly kind of feel like they can do more. And actually all of a sudden, like, be it data, be it the use of a device, like there's something quite exciting about the potential of being able to help the person that you're caring for to get even better care. And I think sometimes we forget that in terms of our kind of, statutory delivery of services. Sorry to say, not all, but I think sometimes that does get forgotten. And actually, like, I think there's an opportunity for people themselves to be contributing to what that kind of better care looks like in the future. And frankly, like, it's going to happen anyway, right? So Dan, you're wearing this watch, I'm wearing my watch, but people who are now a bit younger, who are going to be getting older, and that, that stat I said at the beginning, we're already using these technologies. So if we're not thinking about how we make the most of them and what a new relationship looks like between the data sharing and GPs, all that sort of stuff, then we're going to be missing a massive trick, I think. It's coming.
Thank you, all of you, for that. We've got about 9 minutes left, but before we move on to questions from the audience, I'd love to talk about the importance of collaboration, because it's often the key to unlocking real impact and progress, especially when it comes to innovation. So the question to all of you, but I don't know who wants to start. How does collaboration between key partners address some of those barriers around adoption? Dan?
Yeah, happy to just jump in with a quick comment on this, because I think tying it back to what Tim was saying or describing earlier about, the opportunities to be more predictive in local authorities by, looking at some of the wider determinants of ill health, of challenges, of issues, shows us the power of connecting data to have a more informed, holistic picture of somebody, to be helpful. And I think in terms of collaboration, it can only unlock more opportunities to do that. And as, especially with, we're here because Thames Freeport has kind of pioneered and founded this particular program and this initiative. And the convening power of someone like Thames Freeport across 3 local authorities, public, private, different parts of the ecosystem, can create lots of opportunities to do that. And for perhaps NHS working more closely with local authorities, and the care sector working more closely with local authorities, and startups working more closely with big business and local authorities, etc. So I think the power of AI is only going to be unlocked if we can make those connections in a safe, productive way. So I think collaboration is like essential.
Thanks, Dan.
And building on that, I think the collaboration can help kind of bridge the kind of collective confidence gap that I think we probably see. So, if we've got health working with local government, with communities, with innovators as well, and taking that really human-centered approach and testing and learning, I think we're all benefiting, not least from kind of understanding how that tech could be applied to help potentially meet that sort of need, but also kind of all observing and working out within our own organisations like how we might need to adapt or how we might need to work differently together. I think that's a confidence building thing that only comes from that collaboration. I think is massively critical. That example I was using a couple of minutes ago about care workers undertaking remote monitoring, like a big thing has been trust. How do we trust that caregivers can use these technologies to do that and work with and give that data to health in a way that is going to be useful? Well, technology is doing most of the heavy lifting around that. AI is helping to determine whether the data that's being read is actually effective or not. But it's the working between organisations and the human aspects, I guess, that we're trying to kind of understand and do more on, which is is holding some of this stuff back, I think.
Yeah, and it's push and pull, isn't it? Because I think what's exciting to me is almost like AI data tech is almost forcing a collaboration. Because guys, we all need to solve this problem, and there's a solution here, but we all need to work together. So shall we do it? And so it's one of the hard bits about it, because you have to work across organisational boundaries. But it's also one of the things that's pushing us into it. So we need to kind of go with that, and hopefully it leads to further collaboration. What we're finding is we're establishing relationships with people, with processes, where when we now know, well, if we want that data, or if we want to deliver this thing, then we're going to need to go through this pathway with and it helps that kind of joint working. We know what we're to expect, and we can do it.
Thank you.
I suppose as well, it just building on that, also make sure no one's left behind. I think if we collaborate well, we can help to deliver some of those benefits we talked about really early on around making sure that local job opportunities are at the heart of this AI transformation things. And I think things like that will only become easier if businesses working with public and local authorities, public sector and local authorities, to identify where, how to plug in local skills agendas with this transformation, and help to support perhaps college leavers, school leavers to come into some of these opportunities and upskill in the right skills as well. What are those skills that will be crucial, and all those aspects? So I think kind of making sure all boats rise with this tide, I think is an important outcome as well.
Thank you, all three of you. That was really insightful. And thanks for all your insights today. I think it's been a really rich conversation, and we've covered a lot. So I just want to open up to a few questions from the audience. Not sure if anybody online wants to just drop it in the chat or raise their hand and I can unmute you. We've got a few minutes.
I think there's one, if I read it and you maybe rephrase it, Maxine.
Go for it.
It's around, kind of following on quite nicely from what you guys were just talking about, actually. So, says AI often depends on the quality of the data, garbage in, garbage out. People have only got the data sources they've got. If you, in an ideal world, if you had, carte blanche, what would be dream data sources or dream partners that that would help in the adult social care space?
Great question.
Yeah. I
Go on,
mean, loads of imperfect data. That's right. We're not making the most of what we have, even the imperfect stuff. Right? There's more that can be done. But I think if we're talking like perfect data source, I think what's really interesting is that sort of the watch, the wearable, because that is taking like a truth about the world, right? Which is someone's health status, steps, whatever, right? And if you can start using that to detect, I don't know, falls risk or low blood sugar or whatever it is, that's to me really interesting and really is in the future. But as I say, I don't think we've done enough with what we have. But that to me looks like, wow, really.
I mean, I get like two things that come to mind. One, like a massive underinvestment in data as a skill set, I think, is a thing. So, like, yeah, be that in local authorities, but like, I think one of the challenges there is the capacity. I think, like, we're very lucky, partners like Barking Dagenham with your team, Tim, but that investment in those skill sets to be able to do more with data, which applies to care technologies, it does to a whole range of other things. I think we're missing that opportunity. But I guess also, like, the thread throughout all of this for us has been that AI isn't the thing that's necessarily going to do all the work and solve it. So there is still a human alongside, and ChatGPT or whatever you're using at the moment, or test it, like, it will get stuff wrong. Like, we have to treat AI in this space the same. I think it's supporting the delivery of care. The data will be imperfect. It probably will make some mistakes, as do humans. But actually, how do we begin to use those technologies? Like, thinking like really, about that, the kind of downsides, I guess, of this sort of stuff, and deliberately designing like mechanisms to make sure that it is safe, I guess, in that respect.
Perfect data set. I mean, so many would be really interesting, and it's often at the intersection. Where you get the really interesting insights. But I think, for me personally, I'd be really interested to get better data on nutrition and healthy eating, and sort of understand how we can, factor that into, some of the AI models, some of the predictive analytics, just because it's such a strong determinant of many challenges that we might face further down the line.
Yeah.
And I think could inform positively a lot of really interesting policy changes or enhancements.
Agreed. Yeah. I just want to share an observation from Sharon with you guys. She just said that human oversight is vital at all stages, and she liked what the panel had to say about ensuring the human-centric ethos is kept front and center of the use of tech. So it's quite nice. Awesome. If there aren't any other questions, I just want to say another huge thank you to the three of you for coming today, and for everybody online for joining us. We hope this has been really valuable for everybody, and if you would like to connect or continue the discussion, we'd love to hear from you, so you can find more information I should look in the camera really, about on the Thames Freeport website or on LinkedIn. But thank you all for joining us today.
Cool. Thank you.
Thanks
for hosting.
Thank you, Maxine.
Good.
Host ended the meeting.
Okay.
Hey,
Well done, everyone.
Well done, team.
That was really good.